You even get a sense of how strong the blood is pulsating in the finger from the pulse oximeter reading. None of that is available in the non-in Onyx 9500, nor was it designed to provide that information. It was designed for a different purpose.
Now, how would the pulse oximeter have operated just prior to Michael Jackson's death? You described that there would have been an airway obstruction. What would you expect to have seen or heard?
Are you referring to the non-in Onyx 9500, or do you want to talk about a proper monitor?
A proper monitor.
In a proper monitor, Michael Jackson, with good lungs, breathing supplemental oxygen, would typically have an oxygen saturation of 100%. All of his blood is completely saturated with oxygen, 100%. When he stopped breathing and had a respiratory respiratory arrest, at that point in time, the oxygen in his lungs is starting to be consumed by the blood that's going through it, but it's not being replaced. So there would be a delay of a few moments because he has a reserve of oxygen in his lungs. And the delay might be as long as 30 or 60 seconds. But then, what would happen is that 100 would start to fall to 97, 92, 88, 80. At the same time, you'd hear that pitch, that do, 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 do. It starts to fall, and you hear that instantly, and you know there's a problem. When it reaches a certain set value, I think typically it's 92, but it's adjustable, then alarms start to go off. Alarms to alert you, this patient is in trouble. I would expect to happen within 2 to 3 minutes, and it makes it impossible to miss the fact that the patient is in serious trouble and requires immediate intervention to return the flow of oxygen to the lungs. That's what would have happened if that device had been present.
And if Dr. Murray had been prepared with a proper pulse oximeter with alarm, would you agree that likely could have saved Michael Jackson's life?
That would have saved Michael Jackson's life.
You next talk about the blood pressure cuff, and you find that to be independently an additional egregious violation. Can you please describe your findings and opinion in that regard?
Yes. Propofol lowers the blood pressure. It lowers everybody's blood pressure. It's an expected effect of propofol, which is usually of no consequence to the patient. However, in the operating room, when we see this, we treat this with additional saline solution, or we may choose to treat this with drug, or we may choose to treat this by giving less propofol, turning down the rate of the infusion. In the case of Michael Jackson, who was dehydrated, without monitoring the blood pressure, there was no way of knowing if he was at risk of an exaggerated response. The reason a drop in blood pressure is associated with an exaggerated response is when the blood pressure drops, your body, which normally all the arms and limbs are being perfused, starts to close off the arms and limbs and just preferentially circulate blood to the vital organs, the gut, the heart, and the brain. With a loss in blood pressure, the drug becomes more potent because it winds up primarily going to the vital organs rather than throughout the body, because the body is responding to the drop in blood pressure by shutting down the flow in your arms and legs. So you have to watch the blood pressure. You have to watch it carefully. And the blood pressure is always monitored when these drugs are used. 100%. Not monitoring that, not knowing if Michael Jackson was having a drop in blood pressure, raises the possibility of an exaggerated response simply from the low blood pressure.
And you're aware that a manual blood pressure cuff was found in a box, in a bag, in a cabinet, in another room?
It's not useful there.
And again, you find this to be an egregious violation?
Absolutely.
Dr. Shafer, you talked about the need to have an electrocardiogram when you administer sedatives such as propofol, and you found that to be, again, another independent egregious violation?
Yes.
Please describe your findings there.
You always monitor the electrocardiogram, which allows you to see two things. It allows you to see what the heart rate is. And the heart rate might go quite high or it might go quite low, but it allows you to monitor it. It also allows you to monitor how the heart is beating. Is it beating with a normal rhythm, or has it started to beat with an abnormal rhythm? This is absolutely routine monitoring. In this case, because we have no electrocardiogram, Dr. Murray can't tell us what the heart was doing at the time of the arrest. That shows why you have to have it. He didn't know how to direct his therapy because he was missing an essential monitor, a monitor of the electrocardiogram to show if the heart was beating. So he didn't know what kind of therapy to institute because the monitor was not in place. And that's why you always monitor the electrocardiogram when you are using intravenous sedatives.
You also discuss capnography or capnometry, and you've described through the video what that measures. Was that a violation in the standard of care to not have capnography present?
Absolutely.
Can you describe that, please?
Yes.
And were you of the opinion initially that it was not a violation?
Correct.
Can you describe that, please?
Sure. There are many settings in the hospital where sedatives are given without capnometry. In anesthesia, it's a standard. But other specialties often give these drugs without capnometry. And I'll just say it's a point of discussion. But that's in a hospital where there's backup. So because sedatives are sometimes used without measuring the carbon dioxide, I initially said this is not a violation of the standard of care. In the months since I've written this, I've tried to envision the environment in which this was being used. Again, an environment with no medical backup. An environment in which if there is a problem, there is no emergency equipment, resuscitation equipment is not there. It's a setup for disaster. Capnometry is your first warning. As you saw on the video, as soon as the patient stopped breathing, there was no longer carbon dioxide. It is the hair trigger warning. In this setting, to not have that hair trigger warning so that you would know right when the breathing stopped that there was a problem is inexcusable. I see that as an egregious violation, and I believe that contributed to the death of Michael Jackson.
And you evaluate that based on specifically the setting in which this was taking place?
Absolutely. In this setting, that is an egregious violation.